Committee. My name is Dr. P2 Devgan, and I'm the co-founder and chief medical officer of Volano Vascular, a San Francisco-based medical device company. I'm also the inventor of our FDA-cleared needle-free blood draw technology called PIVO. PIVO is a single-use disposable device that temporarily connects to a hospitalized patient's peripheral IV catheter, like the one I have demoed on my hand, to enable a virtually painless and reliable blood draw. Hospitals around the country, including in California, are adopting IV catheter blood collection with PIVO to improve their patients' experience and eliminate painful needle sticks, to reduce the risk of accidental exposures to their providers and staff, and to improve their laboratory efficiency. There's robust clinical evidence supporting blood draws with IV catheter or from IV catheters with PIVO, which I won't go into all today. In addition to the clinical evidence, PIVO is about to cross roughly about 1 million procedures performed to date, the majority of which have been conducted by trained phlebotomists in other states. There have been 0 adverse events over all of those draws. As a real-world example, I'd like to share a work conducted by Intermountain Healthcare, who measured PIVO's impact on their care. They're the largest health system in Utah, nearby. Like most large health systems, they rely on their phlebotomists to collect the majority of their inpatient samples. They adopted PIVO system-wide roughly about 2 years ago. They've tracked hundreds of thousands of PIVO draws on tens of thousands of hospitalized patients, creating the largest vascular data set as far as we know in the country. Their findings from this data set include no change in IV catheter replacement rates from their phlebotomists using PIVO, a 40% reduction in rejected samples when they're collected with PIVO, and they've removed roughly about 250,000 inpatient needles from their hospital environment. Patient safety is paramount, and this new procedure still has nursing in control of the patient's IV therapy. If an infusion is running through an IV catheter when a blood draw is required, the patient's nurse, and only the nurse, can decide if briefly pausing that infusion is appropriate, and if so, the nurse will flush the IV line before the phlebotomist draws the blood sample with PIVO. This coordination between nursing and phlebotomy is not actually new, and it actually is pretty standard today around the hospital, even with venipuncture. The phlebotomist, to be clear, will never start, stop, or pause any running IV infusion. Lastly, all phlebotomists and nurses complete in-person training and demonstrate competency to perform the procedure safely and effectively. In California today, the majority of blood draws are conducted by phlebotomists in hospitals, and this bill will enable them to utilize safer technologies and procedures moving forward. I urge the committee to vote aye.
Thank you very much. We have 30 seconds left.
Hi, I'm Dr. Fred Brown. I'm currently the Chief Medical Officer, Vice President of Medical Affairs, and I'm a practicing infectious disease physician at Griffin Hospital. I'm here to express my support for PIVO. We actually are the first and longest running hospital that's used PIVO, as well as one of the hospitals that have actually used and talked to our nurses before we even implemented it. It started off with our nurses in our ICU, and then throughout the time frame, we were able to engage their support to transition to have phlebotomists and technicians control the use of blood draws. So again, I'm here in support and as a successful user of PIVO. Thank you. I urge you to vote aye.
Thank you very much for joining us here today.